My name is Sawyer. I work for UNAIDS. I'm one of the founders of ACT UP New York, Housing Works, and Health Gap. I've spent my life as an activist around HIV issues because I myself am HIV positive. I lost my lover to HIV in 1986. He developed KS actually in 1984, and so I've been involved since the very beginning of the epidemic, first as a caregiver, then as a friend of Larry Kramer's, but then as a person who knew I was HIV positive, fighting basically to save my life when I had not been able to save the life of my partner. In the beginning of the epidemic, there was no safety net, there were no treatments for HIV. We didn't even know how HIV was spread. All we knew that people were dying of horrible illnesses and nobody knew why they were caused or how to prevent the deaths. And there really wasn't an appropriate governmental response because the right people were dying. It was queers, it was junkies, it was people of color, and there was no political capital in those groups to force the government or drug companies or societies to respond appropriately. So we had to take to the streets to get the public to care, for the media to cover HIV, and the government to spend money on researching treatments to keep us alive and eventually to help manage the illness. We didn't have a safety net when the HIV epidemic began. Activists fought for social protections. We got HIV included in the Americans with Disabilities Act. We got a lot of anti-discrimination bills passed with regard to housing and employment. We were able to get access to the safety net of income maintenance or welfare, Medicaid cards, food stamps, housing placements, transportation allowances. None of that existed before activists took to the streets. And we forced the government to get research focused so that we could get diseases not only, or get treatments that not only address the opportunistic infections that were killing people with AIDS, but got effective antiretroviral treatments that are allowing many of us, like myself, to live more than 30 years with symptoms of HIV. I think we've succeeded in really doing revolutionary things. We changed the drug approval process, shortening it so that drugs can get into patients' bodies sooner with less intensive clinical trials, and I think that's helped keep some of us who were HIV infected alive long enough to find a treatment that was effective. I think lots of other illnesses have mirrored the HIV activist response, whether it be breast cancer, autism, now non-communicable diseases are all turning to the type of activism that we did. The empowerment of people living with diseases, the whole approach of making diseases people-focused and based on human rights principles has followed the HIV response. And I think those are really positive things that put people at the basis of the health response of many diseases. I think activism, while it doesn't have the complete impact that it had in the early days of the epidemic, that's partially because we were quite successful and got a lot of the problems that we were facing addressed. But I don't think we would have the level of funding that we have now if we didn't still have activists taking to the streets to hold Congress and our administration accountable.